It is our aim to provide high-quality services and treat people with respect in a caring and kind environment. This short video gives a snapshot of how the experience of patients could change in 4 key areas. However, there's a lot more happening which could bring a range of benefits to around 5,000 staff and a potential patient population of nearly 1 million people.
If a patient attends A&E with a cardiac or heart issue, it's possible they could be admitted to an inpatient ward for investigation or treatment.
Currently, if a patient attending Chelsea and Westminster or West Middlesex was found to need specialist cardiac treatment, then it's likely they would be transferred to the Royal Brompton Hospital or Hammersmith Hospital to receive that treatment. The problem with this is that the patient may have to wait for a bed to become available, and in the meantime might have to stay in a bed at Chelsea and Westminster or West Middlesex Hospital while they wait, possibly for a few days.
However, part of our plans for integration is the proposal to create a new cardiac catheter lab. This is a special examination room with diagnostic equipment that helps doctors to see exactly what the problem is with the person's heart. Rather than having to wait, a patient would be taken straight to the lab by ambulance if required, where they receive further diagnosis and treatment. This would then help them to recover as soon as possible and get back home.
I hope you will agree this is much quicker and more convenient for people. Not only would they have swifter access to the treatment they need, but it would also cut down on the time they would have to stay in hospital overall. This is just one of the benefits of both hospitals working together, a much better experience for the patients we care for.
Last year, West Middlesex and Chelsea and Westminster hospitals together diagnosed over 1,800 people with cancer, and research shows it's the #1 health fear for most people.
The good news is that greater awareness of the causes and symptoms of cancer and advances in treatment means that people are now living longer. Cancer survival in the United Kingdom has doubled in the last 40 years.
However, in order to tackle cancer, people need access to excellent healthcare. By integrating our cancer services across West Middlesex and Chelsea and Westminster, it will mean that people can have access to treatment 24 hours a day, 7 days a week.
The way in which we arrange cancer services means that in some cases, patients will be able to receive all of their main care at one hospital. This is including treatment, complementary therapies, and support from our friendly team of doctors and nurses.
But we know that people's experience of cancer vary, and it's necessary for each person to require specialist care. As a new combined organisation, we will be able to give patients greater access to this type of support, designed around the specific needs of the individual and delivered as close to their local hospital as possible.
Our joint cancer services means people will be able to get the help they need when they need it, including out of hours. Not only will they be able to access the expertise they need in one place, they will also have the support of other hospital specialists. We want things to be as seamless as possible for people living with cancer, which is one big advantage of working together.
Having a baby is often one of the most life-changing, life-affirming and exciting experiences women can ever have. So mums-to-be and their families have lots of choices to make. Decisions that women can make jointly with the clinical team include the place of birth. Now, this can range from home birth to delivery in a midwifery-led birthing unit or in a consultant-led delivery suite. Whatever the choice, we are committed to working with women to ensure they have the best experience in a way that is safest for both mother and baby. By coming together, our new joint trust will be one of the largest maternity services in London, managing around 12,000 births every year across 2 sites. Every woman needs a midwife, but not every woman needs an obstetrician or indeed other specialist doctors. The increased combined workforce means that there are many, many more opportunities for women to be supported by midwives throughout their pregnancy and labour, wherever their place of birth, 24 hours a day, 7 days a week, with access to the full backup range of specialist maternity services.
Not only do both hospital sites have brand new and expanded facilities to enable mothers to give birth in a safe and comfortable environment, our combined teams of midwives, doctors and healthcare assistants will work together to give you the care and support you need. A bigger service also means more consultant cover, so you will always have a maternity specialist on hand when you need one. An additional bonus of the integration is better use of new technology. Not only does this mean that we can give you better care in hospital, but we can also give you better support at home, both during and after pregnancy. By making the most of all our modern innovations, we can give you and your baby the best possible start in life.
We know it's very upsetting when a child is unwell, which is why we want to do everything we can to make things as easy as possible. Although both hospitals are very proud of the way in which we look after children, by integrating, we will have a chance to deliver care closer to home to minimise disruption and aid swifter recovery. Although it's important for a child to be in hospital if they need specialist care, once they have received their treatment, it is better if they can continue to recover away from a hospital bed. By merging our paediatric services, we want to introduce new facilities such as a step-down unit away from hospital, to enable families to spend more time with their children in a safe and more secure environment where help is on hand if it's needed. The integration will also mean that parents have access to a wider range of services for their children and will have more choice in where their child receives treatment and any other subsequent checkups or other appointments associated with their care.
By combining forces, we can also share best practice and invest more in research and development, including better technology. Not only will this ensure that our paediatric teams have access to the latest information and education, but can also work closely together to help design even better care plans for children, to enable them to leave hospital sooner and be treated at home wherever possible. Advanced technology will also mean we can develop better systems of integrated care that are designed around children to help our team support parents with decision making, particularly in the case of a very complex medical condition requiring a multiple series of medications. Whatever service you require, our plans for joining together Chelsea and Westminster and West Middlesex hospitals will ensure you have more choice, improved access and a wider team of specialists available to help care for you and to support you. We are taking the best of both organisations to build a bigger and better hospital trust, delivering first-class care for patients both now and in the future. Together, we are greater than the sum of our parts.